Greetings. I'm Michael Bender from the Center for Fiscal Equity. If you read your comments, for the record, you've known me for 10 years, and I'm available to come and see you, staff and members. These are comments for Tuesday, the 2nd of February's hearing on America's mental health crisis. These comments in a different order were made to the Senate Finance Committee hearing in June on mental health care in America, addressing root causes and identifying policy solutions. So this is the House version of the Senate, and I've reworked the order, but the comments are substantially the same. But I didn't make a video of the first part, so if you're in the Ways and Means in the Finance Committee, this will help you. This is something that you can put in your files too, and even post on the website for that hearing if you so choose. And of course, Ways and Means, you can do that as well. If you put the comments on, this would be for the record, this will be a nice addition. Section 1 of the testimony is about refunding mental health. The largest provider of mental health services, including veterans, is the correctional system. So job one is to shift from the correctional modalities to methods featuring mental health and education, including ESL and addiction medicine, warehousing young males of any race, but particularly African American, multiplies social pathologies. While some forms of illness, such as sexual violence and physical violence or murder, may require higher security, others can be treated as patients rather than criminals. We're never going to pass, and nor should we pass, a straight defund the police without taking care of mental health. The best jurisdictions have realized this, and that's what they're moving toward. Hopefully, they'll move quicker. They could do a pilot program. EMS should be identified immediately, and if somebody's drunk or somebody's acting crazy, somebody's homeless, as long as public safety is not in danger, the police should wait. They certainly shouldn't, handcuff somebody and sit on their backs or tase them. No tasers, and definitely not shoot them. So, we don't, let's disarm the police, at least to the extent of treating the mentally ill, and empower EMS. There'd be more funding for hospitals and ambulances. Maybe federal money could help a grant program or a pilot program, but eventually, federal money should probably also go to health, especially if some parts of mental health are part of general health care reform, which means the federal system. So private correction facilities should be also changed from correctional to hospital, and especially Catholic health hospitals, they should be providing the care and the addiction care, and be the prime, and then security can be the subcontractor. For whatever, they shouldn't provide the majority of the workforce. They shouldn't be corrections officers. They should be more on the medical side with different training. There'll be some migration, but the profit motive will be less. I know Catholic Health Association hospitals do have profits, but are a little better in not profiteering. So also we need new standards of individual and societal protection. We can't do catch and release anymore. People simply, if they can't get a bed, or they're not made to stay in a bed, it becomes a correctional system issue. The correctional system is the largest provider of healthcare, as said, and it shouldn't be. It should be hospital care, and the crimes that are used to get people into care. Instead, it should be harder to leave. You know, it shouldn't just be, have new meds. It should be, good therapy, good modalities. The meds should be, proven to work and not drive you crazier than you already were. I know that happens. People on antipsychotics who shouldn't be actually get psychotic on the antipsychotic medication. They have akathisia. If it's, people who are just hypomanic or, mildly delusional, you give them the wrong meds and they get worse. I've seen it time and again because I have been a patient. I've made over the last few years, I've made no apologies for it or hid that from anybody. Pay enough money like we used to for asylums, and ignore Geraldo when he campaigned to close large facilities. We now know he had a very high libertarian bias, and it wasn't straight reporting it. Sorry, Geraldo, but you're largely to blame for this, and we need to reverse course. We need to reverse course now, and then we can fund the police less or transfer the funds because we're transferring the responsibilities, and I'm sure counties and cities will be glad to not jail mental health prisoners. They can, next time they build a new jail, it can be smaller, much smaller actually. And if mental health care is part of a crime, that should be the focus. People should be actually able to plead guilty by reason of insanity, and actually that's in here, and they could be confined for the minimal sentence if they plead that way, or maybe more, and not released until they're well enough to both be in society and to provide restitution and just be normal members. And if people relapse, there shouldn't be a hearing. If it's mental health care or alcohol, you go back. You just go back. Before you become a danger, especially if there's domestic violence involved. It's better for the patients too. If it's hygiene too. If somebody's living on the street, you get them out of danger and you put them in a hospital. Now let's talk about the cost of living for mental health care. SSDI does not cut it. If I owned a vehicle, I couldn't get gas. I certainly can't get a decent car, and older cars sometimes are not worth what you pay for them. So, there's a COLA is needed mid-year. It should have been paid mid-year last summer. It should be paid mid-year now, because food prices are still skyrocketing. You've got too much money chasing too few goods. People have retired, but retirees are between a rock and a hard place. Now this is a short-term emergency, so increase them now, and maybe there'll be a smaller increase at the end of the year. And it should be funded by the general fund because because of a national emergency. Wage growth also is considered inflation. If it migrates up through the chain, and wage growth would happen if the minimum wage was raised. And the mentally ill are underpaid, so they don't want to work. Now, it should also be easier to go back to work and not have severe penalties. And you can do both if you raise the minimum wage. If the minimum wage is raised, then if you rebase by inflation, and it'll be paid for because other people will have more income in the future, and especially if it's a big increase, then suddenly you don't have to change Medicare or Medicaid, because people will just have more money. You don't have to, change the tax streams or, radically change the bend points, or, there's all kinds of things that are on the table that can be taken off the table if you just make people have a higher income. Because without raising minimum wage, more of national income, of AGI, is going toward richer people. The middle class is the same. But the number of people in low-wage income, and by low-wage I mean the bottom 80% of earners, or even the bottom 40% of earners, they don't get as much money. And the top 4%, they've been getting more. What was a third of income in 1965 is now like 40% of income now. What was 30% of income also for the less wealthy has now become 20% or 25%. So, this has an effect. Because ever since 65, what you could buy with a $12 minimum wage, with a minimum wage then now takes 12. Just getting to 10 would be nice. So if the Republicans say, okay, 10 instead of 15, take the deal. We got bluffed in the majority. They should have taken the deal instead of playing hardball. There's been way too much of that lately anyway. And also because mentally ill people deserve to have families and they deserve to be well cared for. CTC benefits should be added to unemployment and to disability. Now, disability actually pays more, but if you pay a lot more, you can actually change survivors benefits and just have everybody making $1,000 a month in benefits per child, which is an increase for everybody, maybe even more so. The CTC should also be distributed with pay, so it doesn't have the stink of welfare. So Joe Manchin will vote for it. Home and community-based health care, we're addressing the president's budget. We should pass it. Medicare Part E should be created for Medicare or Medicaid provided by the states for long-term care. It's out of control, and President Reagan's new federalism would have removed all Medicaid, and I think probably some Medicaid should still stay if it's for poorer people, but definitely for seniors, Medicaid, the impoverished seniors should be federally paid. People in workforce development, education, or in psychiatric rehabilitation programs, like the Center for Behavioral Health does in the Washington area, they should get paid too. And they're great programs, and they should be as universal as possible, like Job Corps. Because people do training if their opportunity costs are met, and if you don't pay them, they may not. So median opportunity cost is an important part of getting people educated and put into some kind of program that's appropriate for them. Medicaid eligible things should be provided to everyone. And I will end this now and talk about veterans and a few other items because this video is getting too long. So there will be a part 2 in just a second.